Let's actually speak with one of the experts here. Now we are speaking about that the UN works to combat domestic violence, and there's a hashtag with her. This morning I'm going to be chatting with Aurora Noguera Ramkisoon. He's the liaison officer of the sub-regional office for the Caribbean, Trinidad. As she is with the, as I said, and the UNFPA. Good morning, Aurora.
Good morning.
Thank you for joining us this morning.
Yes, thank you for having us and giving us the opportunity to speak about the Spotlight Initiative, which looks at the issue of family violence.
Now let's start to disseminate this topic a little. What is the UN doing right now? The UNFPA is doing right now to help raise awareness and help to spread the message.
So the Spotlight Initiative is a European Union funded initiative that partners with the UN and looks at working with civil society organizations and government to put a special emphasis on this issue of family violence. We have over 4.5 million euros for Trinidad and Tobago to address this issue over the next 3 years. The focus of the spotlight is five. It has 5 pillars. It's looking at strengthening legislation and the policy framework. You have UN Women, UNDP working in that area. It's looking at strengthening service provision and organizations that support this issue of family violence. There's also the area of prevention. How do we change social norms and behaviors to prevent violence? And then we're looking at services, how to improve essential services for survivors, data, and then finally working with civil society organizations to ensure a collaborative response. UNFPA in particular is working with the Coalition Against Domestic Violence, who you will hear from. We particularly have been supporting the response to COVID-19, as you mentioned, with the restrictions put in place on movements of people and the stay-at-home measures. We're finding an increase in family violence, which is a form of gender-based violence, particularly with the stay-at-home measures. Now, we know that gender-based violence is not something that is culturally spoken about. And a lot of times from our studies, we see that many survivors do not come forward to access services. So we really have to see how we can get to the root causes. So we, during COVID-19, we worked with some of the first responders to provide immediate support, facilitating remote services through the provisions of phones, computers, telemedicine services. We also have been providing personal protection equipment so that for survivors, services can be provided given the restrictions. But we also have a number of activities coming on board. If you like, I can go through further and explain.
Yes, please. Yeah, let's speak about these activities coming up.
So the activities coming up, as I mentioned, for UNFPA in particular, we'll be working with the Coalition of Domestic Violence on the strengthening of case management services for survivors. In the area of prevention, we have a multi-pronged approach looking at working on changing behaviors and social norms. So we're working with parents and young people who are out of school. We'll be doing an initiative called CHAMP, the Collaborative HIV and AIDS Mental Health Program, but applying it to the issue of family violence. We'll also be working with the Ministry of Education and UWI's Institute of Gender and Development Studies on upgrading the HFLE curriculum in schools so young people in schools will be exposed to information on family violence. We're also going to be working with faith-based leaders and men at the community level, as well as the Employers Consultative Committee and NATUC to work with employers and workers at the workplace to try and transform some of these behaviors. We have a number of activities to improve services as well, including psychological support for survivors, a catalog of economic empowerment services. We're working on the ILO with that initiative so that survivors have outlets to go to, if they want to leave abusive relationships, they'll become aware of what programs, whether they're training programs, entrepreneur programs, microcredit programs to support survivors out of these abusive relationships.
And part of the topic that is, as we were discussing earlier, it's family and gender-based violence. When it comes to the gender-based violence,
excuse me, can you repeat it again?
I was saying that one of the topics that you touched on earlier is family and gender-based violence. When it comes to gender-based violence specifically, are there any facilities offered to individuals who may be members of the LGBTQIA+ community?
Are there any?
Are there any services that are offered to members of the LGBTQIA+ community?
Actually, the spotlight is actually looking to get those to reach those who are most vulnerable and being left behind. So yes, we are targeting interventions both in terms of prevention as well as services. Because if you look at, say for instance, the LGBTQI community and young people, they tend to experience a bit of violence from family members in particular. So we're trying through the work with HFLE to try and work with parents and young people at an early age to respond to this issue of family violence. We'll also have interventions that are targeting the migrant community. As you're aware, there have been a lot of reports of abuse.
That's right.
And so we have coming on board a bilingual application, a bilingual hotline, and we're also working to support services for the differently able. We want to ensure that no one is left behind, and there's a spotlight on family violence, particularly in the 3 targeted communities of Tobago, Puna Piarco, as well as Miaro Rio Claro. But there will be initiatives supporting the whole country as well, but those 3 communities will be targeted.
And if persons needed to get more information, if persons who were interested needed to get into contact, how would they do so?
More information, you can contact the UN, the Spotlight Initiative. Plus, we have a number of partners, such as the Coalition Against Domestic Violence, the Family Planning Association of Trinidad and Tobago, Rape Crisis. There are a number of partners who can assist. In fact, we have a referral pathway that we've developed with the Office of the Prime Minister Gender Affairs, with a listing of key service providers that we can share with the station and with the public of Trinidad and Tobago.
All right, and with that, I want to say thank you so much, Aurora Noguera Ramkisoon, for joining us. And Aurora is the liaison officer of the Sub-Regional Office for the Caribbean, Trinidad and Tobago, UNFPA. All right, thank you very much for your time. All right, for now, we're going to take a short break, and when we come back, there's much more. So stay with us.